Refusing cervical exams. It is the rage online. And I get it. I wish I could have refused all my cervical exams. So it really brings in the clicks when people say you can refuse all of them. But today we're going to talk about why we use cervical exams and if you can refuse them in the hospital and what that might mean for your upcoming labor. Now, really quick, refusing cervical exams or reasons that you want to refuse cervical exams are a great thing to talk about with your partner and put on your birth plan. I have birth plans made easy. That is so helpful. I'm going to put the link down below. It's totally free. Can you refuse cervical exams? Absolutely. But it's really important that you learn about that from an expert. I see a lot of doulas online saying, oh, you can just refuse all the cervical exams. And I'm here to say that that isn't so helpful. First off, they don't do cervical exams, or they definitely should not be doing cervical exams if they're just a doula. And so they may not understand the full concept of why we might need to be cervical exams. And also, sometimes they don't have a wide variety of population to take from. As labor and delivery nurses, we're meeting people right as they come into labor and delivery, and that's very different than doulas who may have built a relationship with this client for a long time. So make sure that you're learning from an expert who really understands cervical exams. I, in fact, am one. I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I have done thousands of cervical exams in my time. Maybe even tens of thousands of cervical exams. So I really understand them and I understand how important they are. And I'm also here to say that I absolutely hated getting them done on my first pregnancy. I actually have tips on if they're painful, so stay tuned for that one. But I understand wanting to balance not having them, but also making sure that you're getting the best care that you need. Okay, so like I said, you can totally refuse cervical exams. You can refuse anything in the hospital, and that comes with a full stop. You can refuse whatever you want at the hospital. But that always comes with consequences. Some of you might not know what a cervical exam is or why it's important. So this is your uterus. Hopefully yours isn't crocheted. But the cervix is the bottom part of your uterus. So the birth canal comes in down here and then we check at the bottom of it. This one's like a 3 to 4. And we just know how baby is starting to push on the cervix and progress into the birth canal. Because as baby comes down into the birth canal, this cervix will open up. And eventually that cervix goes all the way behind the baby's head. Kind of think of it as a very tight sweater that you're pulling on over your head, and then eventually it goes over their head. And there's a lot that we learn from a cervical exam. I know for you, if you've had a cervical exam, we may just give you some numbers. Most often it's reported as like 2 centimeters, 80% effaced, -1. So that means that the cervix is dilated or open 2 centimeters. By the way, got my dilation sheet right here. And I just want to tell you guys that it's actually very difficult to learn cervical exams as a nurse. So if it varies a little bit between person to person, that is not super unusual and it doesn't matter so much. Although if you're in early labor and we're trying to see if your cervix is opening at all, I love it when the same nurse or provider is able to check your cervix both times because they will really know what they felt both times. So that means it's open 2 centimeters, 80% effaced means, as you can imagine, as you pull that tight sweater over your head, the knitting starts to stretch out and thin out. And that means it's 80% thinned out. And then the ±1 to 3 to 4 just means how high or low in the pelvis the baby is. When the baby is equal with these ischial spines right here, that is a 0. When they're higher, that's a minus. And when they're lower, that's a plus. And when your baby's like +4, we really got to get the doctor there. That's what it ultimately means. But beyond that, as a practitioner, there's a lot that I learned from the consistency of your cervix, where it is in the birth canal vault, and how baby is progressing. It's not just those numbers that I learn. And I bet that sounds tricky from somebody who hasn't checked a lot of cervixes or wants that information from their provider. It's just something that you know innately as someone who's checked a lot of cervixes. And those things are super important to know if you come in early labor so that we can tell you what the right spot is for you to be at. Because laboring in the hospital in early labor really is not your best place to do it. It's better that you do it at home. You're much less likely to have interventions. You're much more comfortable at home. You have your food, your people, your favorite blankets, your favorite pillows, and it's really better to do that early laboring at home, even if it doesn't feel like you want to be at home. Hey, Editor Hillary here to say that a lot of people don't feel comfortable at home in early labor. And I actually go over that a bunch in the online prenatal class for couples. So if you're interested in how to deal with early labor, I'm going to put the link down below for you. As practitioners, we have to use those tools to know what the best place to have you is. Also, let's say you think you're contracting, but we check your cervix and it's closed, thick, and high. Maybe we're going to start to realize maybe you have a bladder infection. There's other things that we might diagnose because you're contracting, but it's not making your cervix open. If you like high quality content from experts about labor and delivery, go ahead and give this video a like. We're really trying to grow our channel right now, and every single like really helps our channel grow. And subscribe so we can hang out for the rest of your pregnancy. Okay, so they're offering you a cervical exam. What do you do now? Because the most important part of labor and delivery is making sure that you know how to make choices when the time comes. It's super easy to say, I never want a cervical exam. I mean, I would say the same thing as well. I bet a lot of men think I never want to get a prostate exam, right? But you got to learn to make choices in the moment when you're realizing what the stakes really are. Okay, the first question to ask them is, what is the reason that you're doing this? Is it to decide what the best place for me to be is? Is it to decide if I'm actually in labor? What is the reason that you're doing this? And I am here to tell you that there actually are hospitals who just do it every hour, regardless. Often those are teaching hospitals where residents need to check a lot of cervixes. I'm here to say I don't think that that's super helpful, and that is something that you can easily refuse. If the answer is, we just want to know what your cervix is, not that it's going to have any implications for your plan of care, I would be a quick refusal of that one. And hopefully you caught that, the change in the plan of care. I think that's something that you're really looking for. For instance, in early labor, the change in the plan of care might be you stay at the hospital or you go home. Or if you're having an induction and we want to see if your contractions are actually making your cervix dilate, the change in the plan of care could be that we need to change medications, or we may need to consider going home or changing how we're doing things. That is a change in the plan of care. And I think that's one of the most important things to know about as you're deciding if getting your cervix checked is a good plan for you at that time. And finally, will it put my mind at ease? A lot of people really like having their cervix checked. It helps them to feel more control when they know where their cervix is at. So if you're one of those people who really likes to have their cervix checked and you're at a hospital where they check it every hour, I bet you're absolutely going to love that. I think both things are fine, although it is important to note that there is an increased chance of infection the more frequently we check your cervix if your water is broken. So after water breaks, we're a little less likely to check your cervix as frequently. Now, I hear all the time that you can totally refuse it. Nobody needs to know it. I will say that there is a time where we really need to check your cervix. Sometimes we notice the baby's heart rate is going down, especially after your water is broken. And actually, the umbilical cord can actually slip out of the uterus and the baby's head can push against it, and it can really cause problems for baby. And ultimately, the only way that we can know that is by checking your cervix to see if the umbilical cord is in the birth canal. And there are other things like that, but I want you to know that there are times where we 100% will need to check your cervix if you find the health of your baby to be important. I know a lot of you come into a cervical exam with a lot of trauma, maybe in that area or with healthcare in general. But I'm here to tell you that I think it's super important that you learn to be able to manage a cervical exam. That doesn't mean that you can't ask them to minimize them. We might not even need to do one the whole time you're in labor, especially if your provider's there and is willing to say, yeah, she looks like she's in active labor, let's keep her at the hospital. But there are sometimes circumstances that really require us to check your cervix. So I know for me, I had a really hard time flying, and so I got some therapy to make flying easier for me. And if you find the hospital or cervical exams really difficult, might be worth getting a little bit of therapy so that you can find some tools in your toolbox to help you manage those cervical exams. Now, some of you may just find them painful, and I actually have a whole video about what to do if you find them painful. I actually have a few tips in there that I think you guys are going to find really helpful. There are so many videos that I hope that you will find helpful here at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.